Today, I'll be discussing anatomy of the knee. The knee joint proper is comprised of two joints, the tibiofemoral joint and the patellofemoral joint. These are synovial joints covered in articular cartilage, a white, nearly frictionless tissue that allows for smooth gliding between the articulating joint surfaces. The tibiofemoral joint is the articulation between the distal end of the femur and the proximal end of the tibia. The tibiofemoral joint has both medial and lateral weight-bearing compartments where convex femoral condyles articulate with flatter tibial condyles. Functional stability of the knee is less a function of tight osseous fit between bones and more so created by the soft tissues of the joint. These include 4 primary ligaments, 2 menisci, and a number of muscles. Let's discuss the ligaments. There are 2 central joint ligaments, the anterior and posterior cruciate ligaments, or ACL and PCL. These ligaments arise from the inner aspects of the femoral condyles, cross within the intercondylar notch, and descend to the tibial plateau. The ACL descends on a medial, anterior, and distal course, while the PCL's course is lateral, posterior, and distal. Both ligaments provide important multiplanar stability, most notably in the sagittal plane, where the ACL resists anterior shear and the PCL resists posterior shear. Medially and laterally, the collateral ligaments limit excessive joint motion in the frontal plane. The medial collateral ligament, or MCL, is a broad and flat ligament arising from the medial femoral epicondyle and courses distally to attach to the medial aspect of the proximal tibia. The primary role of the MCL is to resist valgus forces. These are forces that tend to bend the knee outward in the frontal plane, causing knee abduction motion that applies tensile loading to the MCL and ACL. The lateral collateral ligament, or LCL, is a round cord-like ligament that runs inferiorly from the lateral femoral epicondyle to the head of the fibula. The LCL functions to resist varus forces. These are forces that tend to bend the knee inward in the frontal plane, causing knee adduction motion, compressive loading on the medial knee structures, and applying tensile loading to the lateral knee structures. Let's move to the menisci. The medial and lateral menisci are semicircular, fibrocartilaginous structures positioned between the femoral condyles and the tibial plateaus. The menisci reduce compressive stresses to the joint surfaces, assist with joint stability, and provide arthrokinematic guidance to the articulations. The medial meniscus is oval-shaped, while the lateral meniscus is more circular. Now let's review the knee musculature. There are 2 main groups, the knee flexors and knee extensors. The knee flexors include the hamstrings and gastrocnemius muscle groups, sartorius, gracilis, and popliteus muscles. The 2 medial hamstring muscles consist of the semimembranosus and semitendinosus, which pass medial to the knee and attach to the posteromedial tibia. The sartorius and gracilis descend with the semitendinosus and also attach to the posteromedial tibia together as the pes anserine group. The lateral hamstring muscle, the biceps femoris, passes lateral to the knee and attaches largely over the fibular head. The popliteus is a deep triangular muscle that crosses the popliteal fossa. The knee extensors are known as the quadriceps femoris group, consisting of 4 individual muscles, the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. These muscles unite distally to form the quadriceps tendon that attaches to the sesamoid patella bone and then connects the patella to the tibial tuberosity. This is considered the knee extensor mechanism, which is the primary function of the patellofemoral joint. The patellofemoral joint is the articulation between the retropatellar surface and the femur's distal anterior trochlear groove. The patella functionally improves the leverage of the knee extensor mechanism. The patella is stabilized via the patellar tendon's connection to the tibia, quadriceps forces, joint fit, and the surrounding capsule and retinacular tissues.